without further ado, I would love to introduce Sebastian from Denmark. Sebastian is a Fanconi anemia adult whom I'm very happy to know for a long time, and he will speak to us about a very important topic, and he will also cover some ideas on turtles. So, Sebastian, the floor is yours.
Thank you, Annika. Hi, my name is Sebastian. I have Fanconi anemia, and go to that one. Sorry. And today my story will focus on the art of balancing hormones. As you all know, Fanconi anemia gives us the opportunity to deal with a lot of extraordinary variations of cancer and many other side effects. I have many. But today I will zoom in on the effect of hormones, how it feels like not having them, and what happens when they are substituted. Balance should be easy. Believe me, it's not. I was diagnosed with Fanconi anemia when I was 5 weeks old. Over the coming years, I had a range of symptoms and troubles. Doctors found me complex. Over many years, it became clear that I needed substitution on all 4 hormonal axes, meaning 4 different types of medication. I take thyroid hormone, growth hormone, hydrocortisone, and testosterone. All 4 needed to be balanced and rebalanced. The hormone which makes the biggest impact on me as a patient is cortisol. Therefore, cortisol is my center of attention for today. Let me tell you about my first 12 years of life. I did not have an appetite, ever. I lived off a few raisins, 1 sausage, or a small portion of pasta. That was about what I could eat. I felt weak and tired all the time. Even short walks and gym classes was impossible for me. One of the close calls was in a swim class at school. There the teachers needed to pull me out of the water as I was turning green as a cucumber, and so exhausted that I almost could not move. In the last few years, I had a hard time walking up any stairs because I lacked energy. When we went on vacation, I usually became sick for the first 2 to 4 days, probably due to stress caused by changing location. I always felt nauseated when my parents cooked food, especially peas, beans, and cabbage. Just the smell of food could make me sick. I did not know what it felt like not to feel nausea. To me, it was my normal. Now, this is especially for you doctors. What is going on at height 154 centimeters? Right here on this graph showing height for weight, and what is going on with my level of hemoglobin at the exact same time right here. What happened here was my first doses of hydrocortisol. Big impact. After that, I got an appetite and gained over 20 kilos within the first 2 years. I got my strength back and could walk up the stairs without issue, right after the first tablet. It was like in the movie The Matrix. I got the clarity and the power that I had not had for years. The lack of cortisol has left me with a huge eating disorder. I still cannot get near vegetables and fruit and spices. I have a huge mental block to work on. Certain textures and most smells trigger a huge reaction I cannot control. Even pepper or peas on my plate can result in losing appetite and give me nausea for many hours. Hydrocortisone has been a game changer to me. I feel hunger and I like to eat. Over the last years, I have added more things I can eat. Fish and potatoes still need to be fried and not cooked. I still have my mom's homegrown beans on my bucket list. I can see everyone likes them, but I'm still far away from getting comfortable with just the smell of beans. Backside of hydrocortisone is, does it have anything to do with elevated liver counts? Or does it have anything to do with the liver tumor that was diagnosed last November? Before I close, I would like to say thank you for my first time on stage. And of course, you also need to meet my two lovely sisters, Julie and Marie-Louise. By the way, did you notice the turtles on the slides, right down here? My favorite animal is a turtle, all types of turtles and tortoises, perhaps because they have this nice shield to cover a fragile body. If you have any questions, we have time to take a few now. Otherwise, remember to call me. Thank you.
So, Sebastian, you really did a very good job. And we have a few minutes to ask you some questions. So, this weakness that you felt, this was not due to low blood counts. So your hemoglobin was quite at the normal range.
Yeah, my hemoglobin was kind of in the lower range of normal range. But afterwards, as we saw on the graph, it shot up when I got my first doses.
And indeed, I mean, you have been diagnosed with this malformation in the brain very early in life. However, what was again the age that the hydrocortisone was given to you, and why was it so late?
We found the hydrocortisone when I was 12 and a half years old, and it was only found there because my mother and my father went into the endocrinologist and hammered the table and said, "This is stupid. We want to look at the cortisol levels. We know that you haven't really been checking them. We know that my endocrinologist actually said to my mother and me one time that they checked my cortisol levels, but she failed to mention that she had checked them when I was 1. And so she based her knowledge on the fact that they were at normal range when I was 1. And that's kind of stupid, because with FA, you need to check them at least once a year.
So for me, I had a very emotional meeting with you when you introduced yourself in a Danish group, and you just opened your bag and you put out the little pills, and you said you had a life before hydrocortisone and after, and you talked about the clarity of mind. And so what was the impact on the hydrocortisone on your quality of life?
It was huge. Right after I got the first pill, I kind of have this eye-opening moment where I could finally feel, okay, all these 12 years, 10 years that I've been alive, 12 something, I've apparently had nausea. I didn't know. I couldn't put it into words. I didn't feel it because it had been there my whole life. And so when I then took the first pill, I could finally feel, okay, something has really been wrong with me my whole life. And now it is finally a little more normal. So
thank you very much. And in addition to that, maybe this is something for the researchers. It's really amazing how the cortisol also had an impact on your hemoglobin. So yes, thank you. And the floor is open for questions for Sebastian.
Hi, Sebastian. That was a really wonderful talk. Really, really great to hear your insight as a patient. I'm just interested to hear, after taking hydrocortisone, did you have any side effects which was not typical of a hydrocortisone side effect profile?
No, not that I know of. I haven't had any side effects.
Okay, that's great. Thank you.
Hi, Sebastian. This is like great. I just love to hear your presentation, and especially like we have a lot of patients in Brazil. And it's a non-scientific question, but it's a very important question for me as a physician. What do you think? How do you think we should really approach patients with, at least in your view, of course everyone is different and I understand that, but I have a difficulty to understand exactly when they are becoming like teenagers and they really, you don't know what it is that they just don't want to eat because they are like fancy, you know, I don't want this or I don't want that. So what kind of suggestions you could give to doctors here in order not to, either not to force the patients to eat, or even to give some suggestions, or how some clues that you can give to us to understand better what's happening, especially regarding nutrition?
Yeah, so in my case, I have PSIS, pituitary stalk interruption syndrome. And with pituitary stalk interruption syndrome, you should really be looking for all hormones that you can lack. And so if you have a child or if you have an adult who's not eating very well, and this person has PSIS, I would look into cortisol. Of course, if he's just not eating, then that's fine. But looking into cortisol and lack of cortisol, I think, would be the best thing.
Thank you.
Thank you. Thank you for this beautiful talk. So we have evaluated several patients with weakness and this lack of spirit, but even this patient, some of these patients have received treatment with some drugs like an antidepressive or something like that. Did you have or notice any other like emotional alterations beyond the weakness? So more emotional or psychological?
Well, I was very tired at the time without cortisol, and I couldn't really do any activities with my friends, which was really annoying. I didn't run at all for all 12 years, I think. And that may have impacted me because I couldn't really be with my friends like normal kids, and they would always tell me at school, especially when we had gymnastics and stuff, why aren't you running, Sebastian? Run, for God's sake, like, do as the other kids, right? And I was like, I'm too tired. Please, stop this. Stop pestering me. So it has affected me greatly. Yes, I hope that answers your question.
Because we have performed neurological evaluation in several patients, more than 40 patients, and half of them have weakness. And we think that is related with a psychological problem, but not that a metabolic issue. Thank you so much.
Yes, you're welcome.
Thank you, Sebastian. This was wonderful. And I would also engage the digital community to ask questions virtually. And of course, if someone is here in the room not dare to stand at the microphone, please, we have also the Q&A session open here.